Welcome to Healthy Conversations, sharing the knowledge, experience, stories, and the wisdom of herbalists and other natural healers, with your host, Stephen Horn. Today's guest, Chanchal Cabrera. Hi, welcome to another episode of Healthy Conversations. And with me today is Chanchal Cabrera, and I am so happy to have her with me because when I joined the American Herbalist Guild, one of the things that was the best about it was being able to rub shoulders with people who were extremely knowledgeable and through who I learned a lot. So Chanchal, thank you for being with me today. Can you tell us a little bit about your background
Yeah.
so that everybody has a chance to become
Yeah,
familiar with
thank
you?
you, Stephen. Thank you for the invitation, and thank you, everybody, for joining us today. I'm one of the lucky people that has made a professional life as a herbalist all my life. Well, at least let's say all my working life. I went into herbal medicine in my early 20s, and I did a 4-year full-time program in England, which then was a private college, but now, or that later became a Bachelor of Science degree. That degree isn't really available anymore, but that was sort of the level that we got. It was like pre-med, I guess. We did cadaver work, we did full anatomy, physiology, pathology, botany, plant sciences, and then all the clinical applications and clinical hours. So I had that foundation, and I'm so grateful that I went that way and did a solid program right through from beginning to end, because it gave me confidence to get out and do the work, of course, which is where you really do the learning. So I've been a herbalist. Yeah, I've been a
Yeah,
herbalist for
absolutely.
almost 40 years. And it's been a wonderful ride. I'd like to think I've helped a lot of people, but I've also satisfied my own soul with this work.
It is very satisfying to help people with this work. And one of the things that I learned from you is I don't actually remember what conference I was at, but I might have been on two different occasions. I attended lectures that you did on using toxic
Mhm.
botanicals. And now, while the herbs that you're going to find in commerce, at the health food store and everything else like that, these are, you know, really safe remedies. They wouldn't be on the
Mhm.
marketplace if they didn't have a very big margin of safety. But there are plants out there. I mean, some people say, "Oh, it's okay,
Uh-uh.
it's natural," but there are there are plants that are poisonous, and some of these plants can be used as medicine, but they have to be used with extreme skill. So, you want to talk a little bit about this issue of what we call toxic or low dose
Mhm.
botanicals, and let people know, because a lot of people maybe aren't familiar with this
Yeah, thank
idea.
you for bringing up this topic, Stephen. It's definitely an interesting topic. I mean, let's preface it by saying if we're going to talk about toxic botanicals, they are toxic. And so we need to make sure that anyone listening knows to not go and experiment until you've had some training. Let's just say that. I think I
Right.
know the conference that you are referencing. I think it was the American Herbalists Guild conference at the Naropa Institute in Boulder. I don't remember what year it was, but I believe that's where it was, because I remember teaching this class for the first time and actually getting some pushback from a few folk afterwards who said, is that appropriate? Should we be teaching that? Is that safe information to put out there? And my answer, of course, was, it is out there. Let's put it out there in a safe way. The information isn't mine, that I'm like sharing something new and novel. I'm interpreting material that's available, at least from older literature from the time of the eclectics, etc., using, and my tradition, physiomedicalism from England. They used some of these herbs. People do talk about them. Still, they're in some of the books. Let's look at them safely. The irony, this is the funny part, is that this last year, I guess, 2023, the American Herbalists Guild conference was all about low dose botanicals. So from my one paper getting a little pushback from some community members wondering if it was even appropriate, we've come right now, no, full circle now, where the Guild is actually teaching a whole conference focused around that. And that's really exciting to me, because it tells me that these important, useful herbs haven't gone away. They are still being used and valued. And so they are really useful herbs. We're talking about the herbs which So if you're formulating, we all have our own ways of doing it, but the very simplistic model that a lot of people find useful is this kind of pyramid prescribing model, which Jill Stansbury describes so very well in her herbal formulary books, where you have your foundation work that's all about diet and strength and nourishment. And then you have your sort of one side of so that's the base of the triangle, base of the pyramid. Then one side is all about the synergist herbs, the supportive herbs, treating comorbidities, managing symptoms, all of that. And then on the other side, your third leg of the pyramid, so to speak, is the activator herbs, the effector herbs. That's what we're talking about with the low dose or toxic botanicals. They're effector herbs. Everybody can and should be working with the foundations of health. Everybody in their home, everybody with their friends and family. That's not about going to school and being a herbalist. That's about healthy diet, lifestyle, exercise, sleepwear. That's foundation. Then you have the more maybe community herbalist, lay herbalist, general interest, who can manage a lot of basic symptoms and concerns with herbs. And then you have your medical herbalist, your clinical herbalist, who's going to use the effector herbs. And that's what these herbs are. So they're things like lily of the valley that slows the heart and has a
Yeah, now that's the one that I probably
well,
use
it's a
more than any
wonderful
other
herb
that
because
you
it has a
introduced me to.
synergistic effect with digoxin.
Yes.
So it has a positive herb-drug interaction. And with careful monitoring, you can, in fact, and a cooperative prescribing physician, you can actually reduce the dose of digoxin by introducing lily of the valley. And it has less side effects because the glycosides are more water soluble, less cumulative, safer, and still very effective. So that's why we want to know these herbs. It's not because we want to poison people. It's because they
Right.
they have an action that is perhaps more closely considered. It's like a pharmacological action. It's not a nutritive action.
Right.
It's not a tonic action. It's not a supporting detox alterative action. It's pharmacological. It's actually changing a pathway of function in the body. So you have to understand what that pathway is and what the risks and benefits and how to recognize problems and antidotes and all of that. But with that said, these are the herbs that make the difference, that get the real measurable change that encourages the patient to stay with the foundation program long enough to make that change last.
Because the foundational stuff takes a while
Exactly.
for the body to adjust. And sometimes the situation is serious enough that you need to do something to alter the function to stabilize the individual. Obviously, if a person's blood pressure is shooting sky high, that's extremely dangerous. And getting it to come down to a range that's manageable is important while you work on whatever is causing it. And that's the place for this. So,
I was going to say, for keeping people safe, the sort of guardrails that I often suggest for folks is that if you have a health challenge or concern or condition that you would normally self-medicate, choose your own remedies, go to a drugstore, buy something over the counter, at your local drugstore, you could be doing that with herbs on your own, probably quite safely and effectively. But if you have a condition that you would ask the pharmacist's advice, get one of those drugs that's actually not on prescription, but is behind the counter, not on the open shelf, or go see a doctor or a nurse practitioner, those are the conditions you should see a herbalist for if you want to use natural medicine. So that's sort of the guardrails about, how to discern, should I take herbs here or should I go and get advice here? Yeah.
Right. So, and that's where we actually need a professional level of herbalists. Because one of the things I think about some of these quote unquote toxic botanicals is they can do what some of these drug medications do, but I think they have a little better, used properly, they're a little safer. They're not as toxic as the actual isolate drug. Where I first got that idea was from Dr. Weil. I heard him talking about how he learned in medical school about digoxin. And he said that they said in the school the first symptom was nausea, and then the instructor said, but you'll never see that. And then the next symptom of overdose is atrial fib, and the next is ventral fib. But he dug into the literature and he found out that this first symptom of toxicity being nausea came from when they used foxglove, the herb. Because if you started to take the herb and you started to feel nauseous,
Too
you were
much.
taking too much and then you backed off,
Yeah.
which he said is a lot less dangerous than
Yeah.
atrial fib. And so when you gave your workshop, that's
Yeah.
what it really opened me up to, the idea that we could, if we really had a system that was open to it, have people trained to use these things, and they could be used very safely, and just understand the indication. So let's talk a little bit about
Yes.
Lily of the Valley, which I think is a
Yeah.
really interesting one. I had used it prior to hearing about you as a thing to pull slivers.
Okay, oh, that's interesting. I didn't know that use.
Have you?
I have to say,
Have you?
yesterday
Have you?
we were gardening. I have a crew that gardens with me once a week, some volunteers from the community and interns that work with us on the land. And we actually dug out a Lily of the Valley bed the other day, yesterday and the day before. We're not finished yet. It had got infested with weeds. I couldn't manage it anymore. It wasn't looking pretty. And so we've actually dug out a whole bed. So I'm going to be saving all those roots and making, I mean, I don't need a lot. It's a drop, small dose herb, so you don't need tons of it. I love Lily of the Valley because the cardioactive glycosides, by definition, cardioactive glycosides are steroidal, but these ones, because of the nature of the glycosidal bonds, are actually quite water soluble. So what that actually means is they clear the body quite easily. And so I'm not saying you couldn't do harm with the Lily of the Valley, but although it slows the heart in the same way and stabilizes the heart rhythmicity in the same way that digoxin does through the same pathways, it doesn't accumulate. So it actually clears the body quickly. And so if you do take a bit more than you should, it will clear. You're very, very unlikely. I mean, I've never found any literature reference to somebody dying from Lily of the Valley, excepting in, there's a few novels where the protagonist is, the murder mystery and somebody's, being killed with the Lily of the Valley. But it's definitely theoretically possible. And in animal studies, it's been achieved, but it's not something that a medical herbalist is ever going to see in their practice. It clears quickly. You give small doses and you inform the patient about how to, monitor their own well-being, and it's a great, great herb. It slows and calms the heart. So if you've got arrhythmia or atrial fibrillation, although too much of it can totally throw the rhythm, in the right dose, it just gives it that. It's what's called inotropic and chronotropic. So it stabilizes the rate and the force and the rhythm.
Yeah. Well, my father had atrial fib and wound up having to go to the hospital, and they, stopped
Right.
and restarted his heart. And I was trying to figure out, when he had atrial fib, was there anything I could give him? And obviously none of the what you talk about as the remedies that are more safe for the
Right.
community herbalist, the folk herbalist, whatever to use. None of that stuff helped him. But then I actually had a son born with atrial
Gosh.
fib, and they stopped and restarted his heart, and they put him on. They gave me a prescription for digoxin to put on my infant son. Okay, so I did something that I'm going to admit, because it's now
And
years.
he's still around to tell
later,
the tale,
right?
I hope.
Yeah, no, he's still alive. No, I actually made up a mixture of hawthorn and lily of the valley, and I gave that to him instead, and told the doctor I was giving him the medication when I wasn't. But he turned out fine, because I figured it was milder and safer, and I knew the
But you see,
appropriate
that's
dose from
interesting.
having attended you. So that's it. That's an example of the
Yeah.
value of something like that.
So, one of the things with atrial fibrillation is we have to look at why you have it. So, for example, with your dad, he's a little older when he has it. It's very possible that he had some very minor heart attack, but not to the extent that you would even call it that. As with the brain, you can have transient ischemic attacks, TIAs. You can also have mini myocardial infarctions, mini heart, like a tiny little blemish, if you like. If that gets close to or on the pacemaker, the innate pacemaker, the sinoatrial node, then now you have almost like a mechanical irritant, like a bit of scar tissue, a bit of muscle that isn't pulling properly. And for that, stopping and restarting the heart can just reset the electricity. If the electrical rhythmicity is gone awry, that stop-start can reset it. If it doesn't, then an artificial pacemaker can be installed with massive success. It's extremely useful, and I absolutely counsel my patients to get pacemakers if that's necessary. Your alternative could be a lifelong herbal habit, because it won't cure the problem. You'll still be needing to manage it, right? And so herbs, as well as what you talked about, lily of the valley and hawthorn, I would be looking at things like definitely those herbs, but I would also look at Arjuna, which is Terminalia arjuna. It's an Ayurvedic herb that has remarkable tonic properties on the heart, giving more strength and force without using more oxygen. And then the other herb that's really, really interesting and less easy to get, but a very safe herb, is cactus, night blooming cactus. And what cactus does,
I
yeah,
familiar with
it
all of those. Yeah.
resets that sinoatrial node. It actually, one of the problems with the heart, it's an inverted pyramid, right? The base at the top and the apex down in lower into your chest. And the contraction is spiraling around from the bottom, from the apex up to the top. And if there's any enlargement of the heart or derangement of that nerve impulse, then the next impulse is trying to start spiraling before the first one has finished repolarizing, and you don't get rhythmic beats because you haven't finished the first beat before the next one is starting. And that's what cactus is really good for. If you've got jumpy heart, erratic beat, cactus is really the best herb. So there's lots of things to think about. If it's your child, was there an inborn electrical error, an inborn anatomical error, or some unknown cause? In an adult, it's usually a mini stroke, a mini heart attack, but so small it wouldn't even show up on a scan necessarily.
Yeah. Well, I was monitoring him,
Yeah.
and he was doing fine, and he hasn't had any problems since. So it was good. And I've done similar things. So what are some other? Let's just we talked about
low dose
let's talk about just one more.
Well, where they really shine a lot is in pain management. Right. So that's where quite a lot of our low-dose botanicals come. So yellow jasmine, gelsemium, one of the most toxic herbs that we work with. Do not do this without supervision or support. But it's a very, very, very good pain remedy. It actually has... So yellow jasmine, it's not a jasmine. It is a sweet-smelling vine with a yellow flower, but it's not a true jasmine. And the root is the medicine, gelsemium sempervirens, exactly. And the first white settlers in the southern part of the US, where it grows naturally, they were using it for fevers, for the really extreme, those swamp fevers that the settlers were, with all of the mosquitoes, I guess. So I don't think it's probably appropriate for fevers anymore. I think we could do other herbs now.
No.
But for pain...
Well, it was one of the ones that you introduced me to that I did get some of, and I actually can't locate a source for it anymore.
Well, these herbs are hard to get for a reason. They are definitely not on the open catalogs. You have to go asking. But yellow jasmine, it actually has a very sedative effect. Actually, eventually in the brainstem. So if you have too much, you'll get paralysis of heart and respiratory system, and that is obviously not what you want. But before you get there, you get this intense sleepiness, like a real sedation, heavy eyes, heavy jaw, and that's the sign that you've maxed out. If you get those symptoms, you need to stop and back off the dose. And you absolutely don't go driving or operating heavy machinery with this herb. It's a sedative is actually how I use it, especially where pain is causing insomnia, because it's going to work on both the pain and the sleep. So it's a pretty, like made at 1 to 10 tincture, you're looking at like 5 mils a week. It's a very small dose, less than a mil a day of a 1 to 10 tincture, less than 100 mil,
Right. And one of the things I gathered from you that has kind of helped me have more confidence is I will mix the toxic botanical in a small amount with a bunch of milder herbs, and then give them a kind of a normal dose to take. So they're getting a very small amount of the toxic botanical.
Yeah, because it's hard to dose a tiny dose. How do you measure a quarter of a milliliter? But the other safety trick that is well worth remembering And this I learned the hard way with a patient who did take too much yellow jasmine. Many, many, many years ago, I learned from him that I should have, and now do, put in lobelia. Yes, so lobelia is a muscle relaxant, so it's not inappropriate in a pain formula. It's
Right.
always, or even a sleep formula. It's a parasympathomimetic. Lobelia has compounds that fit the nicotinamide receptors in the brain, which puts you into a restful rest and relaxation state. But it also, of course, is a great emetic. So if you put
Right. Which is basically lobelia would be
yes,
considered a toxic botanical, except that it's so
right.
good at making you
Nobody's
throw up
ever actually
that
died of
it's
lobelia
good.
poisoning, although the books say they have. If you
Yes,
follow that thread, maybe you've had this conversation, Stephen, but with Paul
I
Bergner, he
have.
followed all that research back and found it was just a court appearance of Samuel Thompson challenged on death by lobelia, for which he was let go. So that,
Well, actually, Chanchal. I mean, when I was working at Nature Sunshine, the FDA came after them for lobelia in their formulas, and the botanist went and did a literature search, and she did actually find 2 deaths attributed to lobelia. You want to hear what they were? A elderly patient in England in 1890 took lobelia as an emetic, and he had a bleeding ulcer. And in the act of throwing up, he tore the
yeah.
ulcer in his stomach, and he bled to death. Okay, the other one was a lady who had been smoking Datura and lobelia cigarettes for 20 years for relief of her asthma, and they blamed her death on lobelia.
My point exactly.
Yeah,
Yes.
so basically, in other words, you're right, saying nobody has ever been recorded
But
to have died from it. Well, anyway,
it
that's
will
terrific because
definitely,
then they take
yes.
too much, they
So
throw up.
the patient I learned this from took a whacking dose of a pain formula I had made for him. Basically, I'd asked him to take it in divided doses over the day, and he took 3 days worth in one swig and was pretty out of it, like pretty comatose. I write about that in my cancer book. Actually, I have a chapter on pain because it's an important point. And he was on the floor, with a cushion and a blankie because he couldn't get off the floor. So I learned from that people who are in severe pain don't make good decisions. And if a little bit is going to work, more
Very
will help more. And so if I'd had lobelia in his formula, he would have swigged back that much and vomited it up almost immediately. And that's what I do now when I give strong herbs, especially for a pain condition, because of that poor judgment that happens when you're in extreme pain. Lobelia is my secret weapon. So it's only about 5 ml of a 1 to 8 lobelia in the formula, and sometimes less, 2 to 3 ml even in a 100 ml formula, and it is enough to turn the stomach.
yeah. Well, the reason why I was grateful for you for helping learn about that herb is because there are a couple of people who've been like end stage fourth, who've come to me and they're like in the final stages of dying of cancer, and the drugs that they're being given aren't working for pain anymore. And I
Yes.
have used gelsemium to help
Yeah.
ease
Yeah.
their suffering, and that's been it hasn't cured them, but easing
Yeah.
someone's
It's
suffering in that
very
last little bit
important.
is an
Yeah, and
amazing
one
thing
of
to be
the
able to
things
do,
that
you know?
happens in that end stage is that you're usually in a lot of pain, and then you end up on morphine, and then you're in the twilight zone.
Yeah,
And the
yeah.
gelsemium, it is a sedative, but you don't get loopy in the way that you can on morphine. And the other herb that's super interesting at that time is a different kind of poppy, which is Corydalis. Now, Corydalis is, and
I
it's
love
not a
Coriodalis.
drop dose, low dose, high risk herb at all, but it's a very effective herb for pain. And when people are reaching for morphine, because it's working in a lot of the same pathways, you can actually use it to reduce the reliance on the morphine. And it too is slightly sedative, but not the same, and not addictive, and all kinds of things.
I have
Yes,
used Coriodalis to help people transition off of
exactly.
morphine and to a
Exactly.
more natural pain.
Yeah.
So that's been really good. Well,
Yes.
Chanchal, this has been a fantastic discussion, and I
Mm-hmm.
so appreciate what I have learned from you, and also you're sharing this incredible wisdom with the people who are listening to my podcast. So, again, we're not talking about stuff that you're going to be able to run out and buy at the health food store. And if you are able to get a hold of this, you better do some research, know exactly what the side effects are, what the signs of toxicity are, and understand that you do very tiny dosing and everything like we're talking about. You need some training, which I'm really grateful for Chanchal for giving people like me some of this training. But we need to understand there is a value for this in our modern society. And it's one of the things that I think can make the difference between a folk herbalist and a professional herbalist is the ability to use these botanicals. So
yeah, thank you for the opportunity, Stephen.
Great job.
These are really interesting herbs to talk about, and there are many more of these, intense herbs that we can review maybe in another conversation sometime, because they're really, I don't want them to get lost. There's a lot of wonderful foundation herbs and synergist herbs and symptom management herbs, but the effector herbs are really interesting to work with. And as you say, that's what clinical herbalists are doing, and it's important to keep this information out there in a safe way.
Yes, it is. Thanks again.
Thanks.
We'll catch you on another episode. Goodbye, everybody.
Hit the like button and subscribe to our channel to catch future episodes of Healthy Conversations. Help us educate others by sharing this video, and please feel free to share your own thoughts, comments, and questions below. To learn more, check out the links below.